Now, I know we all want to live a long, healthy life, but I want you to think about this. If you're a pet parent, living a longer, healthy life means more than likely you're going to have several pets that share your life over the years. But what if your pet could live a longer, healthier life just like you? In today's episode, Dr. Kevin Toman joins me. He's also known as the longevity vet. Now, being a veterinarian for over 40 years, several years ago, he came to this conclusion that the veterinary system was just broken. And now he's on a mission to fix that. He believes we all should be helping pets live longer. So much so that his website's just that, helping pets live longer. Now, we do a deep dive into the many ways and the many changes we can do to give our best friends that longer, healthier life. We get into diet. We get into exercise. We get into vaccines. We get into supplements and so much more. So if you plan on being that young whippersnapper, why not help your best friends be young whippersnappers too?
For real, 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 for real. Got a bunch of furry friends and I love them all the same. I'm an animal lover, veterinarian is the name. Let's share some pet stories from heartwarming to strange, losses and gains, from wacky to insane. For real. You're now tuned in to For Real with your host, Mark Kyle.
Everybody, and welcome back to the For Real podcast. Today, I've got a big treat for you. I've got the longevity vet with me, Dr. Kevin Toman. Welcome to the show, and I can't wait to talk to you about everything. I'm a big fan of longevity in animals and humans as well, so this will be a good one.
Well, thank you very much. I appreciate all the work you do for us pet lovers nationwide. I've listened to a couple of your podcasts, and I know exactly how much work you put into them, and so I hopefully your listeners do too.
Well, thank you for that. But it's really, it always really comes down to the guests. And, I told you this early, and I say this all the time. I'm really the waiter. You're the chef giving us the meal. And, I know what the subject is, but I'm going to let you talk about it, and we'll just go from there. So what I typically do, and again, as we were talking earlier for you guys that are listening, is we're talking about kind of how we're going to structure this thing. But I want to do is talk about your journey, where you grew up, how you got to what we're going to talk about today. Let's go whatever you want to do. I'm going to pass the baton to you and just, let's hear your story.
Yeah, my name is Kevin. I've been a veterinarian for 40 years now. I graduated from UC Davis back in 1986. And the backstory to that was that I was raised in central Illinois, spent a lot of time on farms, doing a little farm fly fishing back there, catching bass and bluegill. But I always knew I wanted to be a veterinarian. The reality is, even from a young age, I started working with a horse doctor back when I was in fourth grade, and it was just it was a clear trajectory for me that ended up in my getting into UC Davis, spending 7 or 8 years there, and the rest is history. Once I graduated, I moved into Northern California and set up a series of veterinary clinics. Realistically, I was living in small towns there, and I functioned as kind of the regional emergency clinic, so got my hands dirty right off the bat. And then I ended up moving to Colorado for a couple decades and back out here to the central coast of California.
So I'm gonna go back to fishing. I love fishing.
All right, attaboy.
You and I are on the same page in that. So it's funny is that most people don't realize, when you think about fly fishing, of course, you think about the river runs through it. And by the way, have you seen that show Madison yet?
I have not, but I will tell you that I spent 11 years of my life floating the Madison River.
Me too.
And in fact, the name of my first dog was Macatee because I floated from Varney Bridge to Macatee, and that was about a 21-mile float, which was a long ass float back in the day. And I was always so stinking happy to see Macatee Bridge that I named my first dog after him.
That's pretty cool. And I've actually fished in Madison too. But you'll like the show. First of all, I think Taylor Sheridan in one of his millions of shows now, but they do a lot of fly fishing on it. I just started watching it last night. Some of it's real. It's and you can tell they kind of know how to fly fish, but they kind of don't.
Yeah.
But some of the stuff that they bring up is very real. They talk about a caddis hatch at some point, which you'll get You'll know exactly when that scene is. I'm literally in my mind thinking it's a cat assassin. Sure enough, they talk about it, which is kind of funny. But more importantly or not, I don't know more importantly, but after the first episode, they said a thank you to Robert Redford, which I thought was interesting because at the beginning, I think it may be at the beginning of all the shows, they show a lot of the river. And if you saw a river runs through it, they were fishing in Missoula, but they really weren't. They were fishing in the Gallatin. And it looks like to me like it's the Gallatin. So I'm curious what.
I think you're right. And it's an interesting intersection there because one of the guys that I guided with back in the day, Mark, was a fellow named Jerry Seam, Siem. He's now graduated. He's a big muckety muck in the fly rod world, but he was the casting double for Brad Pitt.
Oh, so he's an ugly guy.
Yeah. Well, I always considered him ugly, but maybe the girls don't.
I love the Gallatin. That's one of my favorite rivers, actually.
Yeah, I love the Gallatin as well. I'm a little concerned about the population influx into Bozeman.
Right.
But as I mentioned, my girlfriend and I are headed back up there this fall, so I'll see firsthand.
Okay, so like I told you the other day, and as anybody that listens, they know I float all over the place, literally when we're talking about fly fishing too. But what I was going to say is that in Illinois, where you're fishing for bluegill and bass, most people think about trout. They don't really think about bass, and bass fishing with a fly rod is as good as it gets.
Yeah, I was in Bloomington area, down in kind of center state, which is the home of State Farm Insurance, and that's really at that point in time all it had going for it. But my grandparents had a number of farmer friends, rancher friends around the perimeter, and virtually every one of them, Mark, had ponds on their property.
Right.
Primarily for the purpose of feeding livestock or sucking water out for local irrigation or the like. But every one of those ponds had either bass or bluegill or sometimes both in it.
Right.
And so really I owe my fly fishing roots to my maternal grandfather who took me out there and tied a little cork popper on the end of my line. I catch, 6-inch bluegill all day long. And I thought that was wonderful sport. Wonderful sport.
Here in Austin, we have it's a river, but they call it a lake because in Texas everything's bigger. So if you dam it up, it's a river. And we lived on one for a while. I used to have these little yellow poppers, and for the bluegill for my kids, they would catch the bluegill all the time with that.
Yeah, absolutely. It's a great way to start. And listen, I freely admit, I told you yesterday during our conversation that I'm a trout fisherman. I'm a small creek guy, really, when you get right down to it. And I love that with all my heart. But I owe the roots of my fly fishing to these farm ponds in the Midwest.
So last thing, and then we'll get back to what we're talking about. So I was born in St. Louis. So my parents, for their honeymoon, went to the Ozarks. And my dad was an avid fisherman. Uh-huh. And he used to, Merrimack Springs, I think, was where they used to go trout fishing all the time.
Okay. Yeah. Yeah, and that's still, you hear about Missouri turkey hunting, bird hunting, and bass fishing, but you don't hear about the trout fishing. And a large number of the guides that I worked with in the Yellowstone area back in the day were actually from Missouri. They would hunt during the winter, during fall and winter. They'd fish during the spring and summer. It seemed like a pretty good life at that time.
Sounds like a great life, actually. So anyways, let's get back on track. So we can talk fishing all day, and I can too. So, but let's talk about you. So you loved animals all your life. You're a vet. You've got vet clinics in Northern California. You moved to Colorado at this point. Are you doing vet?
To fish that I'm going to tie it back into fishing. So. Oh,
really?
Yeah. I had a couple fairly large practices up in what they call the Gold Country here in California, but. When I went through a breakup with my then girlfriend and thought, gosh, I'm just going to kind of get back to my roots. So I moved over to southwestern Colorado and found a little place on the banks of the Dolores River. And, I stayed there for 20 years until the snow drove me out.
Is that Durango? Is that where that is?
That's between Durango and Telluride.
Okay, cool. I've only been to Telluride once. I've always wanted to go back. It's such a beautiful city.
It is.
But anyways, let's get back to veterinary. So, are you doing? I know you're fishing. Are you subbing in as a vet at that point, or what were you doing veterinary wise, or were
Well,
you?
like I say, I mean, this entrepreneur thing, once it takes hold of you, it's hard to get rid of. And so I opened a veterinary clinic in Durango and then one in Pagosa Springs,
Okay.
and eventually sold both of those, and then opened a smaller practice in Dolores. And my wife at that point in time and we ran a bed and breakfast during the day, and she ran the bed and breakfast, and I worked as a veterinarian. And I would come back in the late afternoons and guide her bed and breakfast clients up and down the river. So
That's cool.
the times were full back in the day. But the reality is that, as I mentioned, after about 19 years, to be exact, in the snow, that life at 8,000 foot kind of wore on me, because there were times, Mark, when I would have to plow my 1/3 mile driveway to get out to go to work. And then I'd leave my skid steer down at the bridge so that I could plow my way back in after work. And, that's a young man's lifestyle, I guess is what I would say. And so where I live here in Cayucas, California on the Central Coast, it snows one heck of a lot less than it did there.
Like basically never. So you're in Cayucas. Let's move forward. So do you open a clinic there? I know what you're doing now. Are you doing what you're doing now when you get to Cayucas?
No, it's been a little bit of an evolution.
Okay.
And so in all candor, back in 2011, when we hit Thanksgiving, which was always a wonderful holiday, but it was also a season of impending doom for me with the snow coming in. And so my then wife and I took a drive over to California, and I was looking for places to live, Mark, and the two criteria that I put on those places to live were moving water of one type or another and a local college. And so I started down in San Diego and drove up along the coast, essentially, to mid-state Oregon. And I loved the Ashland area, Ashland, Oregon,
Sure.
a little town called Jacksonville that has a lot going on. But I came back down. The last stop on the hit parade was San Luis Obispo. And I found a retail space for rent that had Trader Joe's on one side of it and Starbucks on the other. And if you're in a client-oriented business like mine, in the small animal veterinary world, having Starbucks and Trader Joe's for neighbors is like, that's one of those nirvana moments. And so I felt like the stars had aligned. I reserved that spot to open a clinic. And then I was lucky enough to find a little place to live in the small town of Cayucas. And then to complete that story, and I apologize, my little golden retriever puppy Annabelle is shaking my laptop here. But to complete that story, I practiced for about 7 or 8 years in San Luis Obispo and grew the practice substantially from one doc to 5 docs and about 25 helpers. And then I was approached by the corporate entities that are in my mind ruining veterinary medicine. And we can talk more about that. But I hoard myself out. I sold to them because of the price. It was a proverbial price that I could not afford to pass up.
Yeah.
And so as of 2018, I was a free agent again, and I decided to concentrate exactly on what I love, which is the pet longevity space. And I use a combination of concierge consults, proven supplements, and prescription longevity drugs like rapamycin, acarbose, and their pals to help the patients in my care live the longest and best life. And it's a fascinating journey. I learn something every day from people like you. And so it's both humbling and exciting at the same time.
So again, off track, and then we'll get right back to it. So as I told you, my brother lives in San Luis Obispo. He's been there since he went to college there. And I know exactly where that Trader Joe's is, and I know where the Starbucks is too. So I know where your practice was. It's funny. Small world.
Yep.
For real, 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 for real.
And we'll be right back.
As a pet lover, did you know your pet can benefit from the incredible healing power of stem cell therapy? Prep Therapy offers a groundbreaking solution taken right from your pet's own blood. Say goodbye to joint pain, arthritis, kidney and liver conditions, and more. They'll experience faster recovery, increased vitality, and extended quality of life without the need for surgery or harmful drugs. Put the wag back in their tail and discover Prep Therapy today at prepvet.com. Save 10% with promo code FurRealPodcast, covered by most pet insurance.
Let's get into this now. And I'm not sure what direction to go. Let's go with Let's go with the corporate thing. So I'm going to say a little bit, and then you got a whole different view of it. As anybody knows, in the world today, everything's consolidating from accounting to whatever. And in the veterinary world, if for you guys, if you have a clinic you've been going to for a long time, there's a good chance there's two or three really big ones, and there's other ones that are doing it now as well. VCA being one of them, and I don't have anything personally against them. It's the Mars company that owns them, and all that. But there's a consolidation, and in some levels, it's a great thing. In a lot of ways, I would assume from your perspective, being a doctor, it's got to be frustrating. So I'm going to pass it back to you and let you do that. I just wanted to kind of set the stage.
Sure. Well, and thank you for that. And I agree. I can approach this in two different ways. As a selling veterinarian, again, I prostituted myself out. I sold to those big bad corporate acquirers because in all candor, they could offer me a multiple on my practice that was literally 3x what I could sell to another veterinarian. And the hard part, Mark, is that to open the back door of the veterinary world. Once you get beyond one or two or maybe 2.5 veterinarians, it's very difficult for the veterinarian next door or your junior associate to buy your practice just because the dollar's involved.
Right.
And so if you grow a large practice, by definition, you're relatively limited in the people that can buy it. And, there are a number of different corporate acquisition chains out there. And as you suggested, it's intriguing to me that the biggest candy bar maker in the world is now the biggest veterinary clinic owner as well. And I'm speaking of Mars Candy Bars. And apparently they think of veterinary medicine as a solid long-term investment. But the hard part right now, Mark, is, and I preface this again with mea culpa, but I believe that veterinary medicine, at least in the small animal world, is broken. And the reason I say that is because these corporate chains, they're poaching graduates right out of school. They're offering them dollars that you and I can't match as sole proprietorships. And what happens then is that these veterinarians are told, listen, you have 15 minutes in an examination or 20 minutes in an examination room. You have a list of medications that you can use. You have a list of vaccines that you have to promote. You can't tie this to the individual pet care. You really have it's just a template of veterinary medicine. And that does all of us a big disservice. And one thing I'll tell you, Mark, I'll confide in you, is that, I may not have been the world's best veterinarian along the way, but I prided myself as being a relationship builder. If you came in, like in your Labrador Retriever or whatever, first thing I was going to do, I was going to give you a hug or shake your hand. We'd sit down and talk about fishing, or we'd talk about, the world writ large. And it'd be nothing for me to spend 45 minutes or an hour with you. But unfortunately, those days are gone. The reality is that the new days of corporate veterinary medicine are here, and with that comes compensation on the veterinarian's part that is tied directly to how much they charge you.
Yeah.
The typical compensation model for veterinarians, Mark, is a flat salary, typically $70,000 or $80,000, nothing to write home about, but then 25% of the money that you make for your corporate employer. And so the unfortunate truth is this. I'm casting a broad net here,
right?
But let me say, when I speak to corporate veterinary medicine, your pet's veterinary care is not necessarily dictated on what's best for them. Your pet's veterinary care may be dictated by what's best for your pet, but it also is dictated by how much money your veterinarian can make.
Well, there's a couple things on that too. There are a lot of them, and by the way, I'm not bad mouthing either or, because there are great clinics that have been bought up by the corporate world, but they're still great vets doing things. So I want to be real careful on how I say that. But what part of their model is vaccinations and spay and neuter, because that's fast, easy, and they're burn and churn a little bit. And from their model, by the way, just talking about Mars Candy, they're obviously very successful. There's some great. When you look at their story and where they got and how they won, it's a pretty fascinating story. But they also own Pedigree. So when you go into their clinics and they have dog food there, that's their brand. And I listened to a podcast, surprisingly. Me listen to a podcast, but it was on these businesses, and it was based on their original, when they were selling candy, they were the first ones to put up the racks of candy when you go through the line to pay for it. And that's where they made their money, is by actually putting it out there. They paid for the racks, and now there isn't a store you don't go by that has that. But it's very similar. When I'm listening, I go, well, that's exactly what they're doing in these clinics. Now you go in, they got bags of dog food. Guess what? Guess who owns it? So they're double dipping in some ways.
Yeah. Yeah. And there's ample room. You and I can wander through this conversation in a number of different ways.
Right.
And a couple of the ways that I'll toss this ball up in the air for you, but I would tell you that when I graduated from veterinary school, Mark, back in 1986, I was told that every pet needed vaccines, multiple vaccines every year, and that was best for the pet. But we didn't have any business classes back then.
Right.
And so I think the underlying theory was that annual vaccines were also best for the clinic's economic viability.
Sure.
And now, one of the things that I counsel against in my role as the longevity vet is against many of the commonly used vaccines. You and I can talk about vaccines that have logic behind them. And listen, I'm separating rabies out from the equation because that's mandatory in virtually every state. But there are vaccines that have no practical application for your pet, and yet many veterinarians are still recommending them. And in the case of cats in particular, listen, every time I poke a needle through a cat's skin, I'm setting the table for a sarcoma, for a vaccine-related cancer that in many cases is fatal. And not to get too far down this road, but if you took your cat into a veterinary clinic for rabies vaccine, the current thought, Mark, is that you would vaccinate that cat as low down on their right hind limb as possible. Why do you vaccinate cats down low on their right hind limb or their left hind limb for leukemia? Because if they develop a sarcoma at the site of injection, it's easier to amputate that limb than it is if you vaccinate someplace else. So let's think about this for just 1 second. And I don't mean to stand up on a soapbox, but you and I are creating the risk of fatal skin cancer by vaccinating a cat. Well, we better make damn sure that vaccine is needed before we start thinking about that. And then the other thing, and I'll stand down off that soapbox and climb up on another one, but, I'm 66 at this point in time. And for 50 or so of those years, I preached the gospel of kibbled diets, because I felt like, certainly they're easiest and in many cases they're cheapest as well. But now one of the things that we're learning about pet diets is that in fact kibbled diets really set the table for a bunch of different diseases, including cancer as well. And so again, mea culpa. These are, you and I can talk all day long about the mistakes that I have made over a 40-year period of practice, Mark. And that's one of them. Kibble diets, I think, are kind of passé these days. They're no longer, and I'm speaking about the average kibble. But I worry that the negatives of kibbled diets outweigh the positives for dogs and cats in our care.
Well, wait a minute. I want to go back a little bit. Talk to me about sarcoma in cats on their skin. This is something I'm not familiar with. So walk me through that a little bit. What's the science behind that and what's going on with it? Because I've never heard that before.
Yeah. And I'm going to be hard pressed. Listen, I think I'm probably the follower in the scientific literature in this conversation as opposed to leader. But for whatever reason, cats have many peculiarities, Mark, and anytime their skin gets punctured by anything, whether that be another cat's claw or in the case of our vaccine needles, their immune system is so profound that many cats will develop a small lump at the site of that injection. And 99% of the time, well, maybe not 97 to 98% of the time, that lump persists for 2 or 3 weeks and then it disappears. But every once in a while, that lump becomes a malignancy, and it's called a vaccine-related sarcoma. And this is a tremendously aggressive skin cancer. And I would tell you, in all honesty, that over my 40-year veterinary career, I know that I have killed probably 7 or 8 cats by vaccinating them, and probably more. These are cats that are lost to my follow-up. But the reality is that hurts, Mark. I mean, there are several things that keep me up at night about my veterinary career, and that's one of them, because I was trying to help these kitties, and inadvertently I started digging them a hole that they could not recover from.
One thing that it makes me think a little bit when you're talking about the big corporations that are now not pushing, but encouraging people to get vaccines, which as a pet owner, that's what we've heard from since the beginning of going to veterinary clinics, is that if you're a big corporation similar to in the human side of the world contracts, if you've got a big contract, you're probably more than likely, I don't know this, but I'm sure it's true, they've got a huge contract with whoever's got the whatever vaccine that may be. So they're now making more profit from that, which they have every right to because they've got, they're the gorillas. So they're buying at different pricing. So the clinics are more profitable that way as well.
Yeah, absolutely. And let me be clear, the vaccine-related sarcoma issue is strictly in cats.
Right.
But I think that if you and I understand that the most common cancer in dogs is lymphoma, which is an it's a disease of the immune system, and vaccines are designed to stimulate that immune system by definition, somewhere there is a trade-off in there, Mark. And so I want to be clear about this. Listen, back in the day, I got bit by, of all things, a cow that was drooling profusely, and that was one of the signs of rabies. And so I went through the whole 32-shot rabies series myself, and I can speak very directly to the pleasure of that. And I also, back in the day, 1988, 1989, I went through the original dog parvovirus outbreak. And parvo killed every dog it came into contact with,
Sure.
Mark. I mean, it was just a fucking nightmare. And I'm sorry, edit that. But at any rate, so I fully understand the benefits of vaccines. And I want to be absolutely clear about this to your pet parent listeners. Your dog or your cat does need some vaccines, but perhaps not all the vaccines that your veterinarian is suggesting. And the two that I would point to very directly are the kennel cough vaccine, Bordetella, which most vets vaccinate routinely on an annual basis. But here's the thing. It only lasts at high levels for 2 to 3 months. So why are we vaccinating on an annual basis for a disease that is only found when you put your dog in a kennel, or if you hit the show ring, or you're hunting over them with other dogs? Why not tie that particular vaccine to those incidents, to those episodes, and vaccinate maybe a week before you're scheduled on your trip? Stop vaccinating on an annual basis for that. And the one that just drives me crazy is the whole canine flu vaccine. And you know how many, so I'll give you a piece of science here. You know how many cases of canine flu there were in the United States in 2025?
I have no idea.
11. 11.
Of course.
And 6 of those were in California. 4 of those were in Georgia. And there was one, I think, in North Carolina. But veterinarians across the United States are still recommending these vaccines on an annual basis for you. And, we confidentially, a lot of veterinarians are just calling this disease the Merck flu because Merck is the vaccine manufacturer and they're the ones who are recommending this. This disease is a non-entity. So stop puncturing your pets in an effort to stop a disease that has no bearing for your pet's health.
So I'm wondering, and you would know this, are they new vets when they're going through vet school? Is that what they're being taught is the vaccine thing? Because, we had that conversation when you come out of school, you think you know all this stuff because you were taught it in school. Is the vaccine thing being taught in school?
I suspect so, and I hope that there's some blowback to it. But by definition, many of the professors in veterinary school are older. They're my demographic, and so they were trained one way, and a lot of them, in all candor, Mark, have never been out in the real world. I would wonder how many of the feline internal medicine docs or the docs, the professors who are espousing these vaccines have actually seen a vaccine-related sarcoma, and walked in and looked in the owner's eyes and said, "You did this with your vaccine needle. Now help me." And you cut this cat today, and and the sarcoma grows back. So you cut it again next month, the next 2 months after that, and after 5 or 6 surgeries, everybody throws up their hands. And it's just listen, I am a believer in vaccines, but please just ask your vet why. That's, I guess, if you take nothing else from this podcast with Mark here, ask your veterinarian why they are making this decision on behalf of your pet. If they can't explain exactly why your pet is at risk for a given injection, excuse me, let me try that again. If they can't explain why your pet is at risk for a given disease, don't let them vaccinate.
Okay, I'm 100% on page with you there. So let's talk about longevity. Let's go whatever, everybody wants their pet to live forever because they're part of the family. Let's kind of just go through the baby steps and we can go off in any direction you want to go. I want my dog's name's Mabel. I want her to live a long time. Obviously, you go whatever direction. I can think of 100 ways we do this, but you just kind of go first steps.
Well, so let's use Mabel as an example. How much does Mabel weigh? Tell me about her.
Okay, she weighs right around 45 pounds.
Okay, so that's a sweet spot, actually. What breed is she?
I call her Mexican rat dog.
All right. Well, you're not going to be any fun to talk to because
she's part hound, but she's definitely a Heinz 57.
Fair enough. Well, the reason for my asking, Mark, is this. Just as no one-size-fits-all vaccine program exists, neither does one-size-fit-all longevity science exist. And so the strategies that you and I would use for a small dog are different from those for a cat. And each of those is in turn different from those of a large breed dog. So when I look at the longevity vet framework here, it's really a 4-pillar process. There are 4 legs to that chair. One is diet and lifestyle. And we talked a little bit about diet already, but again, you and I can wander down any one of these paths without any fear. So the first chair leg is diet and lifestyle. The second is where your local veterinarian gets involved, and that centers primarily around dental care and early diagnostics. And come back to that if you'd like. The third chair of that stool is proven supplements, because listen, there is a lot of bullshit on the supplement market. And I know that might be news to you, but I can speak very directly to supplements that have been entirely disproven, things that I sold for 20 years. So yet another mistake on Kevin's part. And then the final leg of that chair is in fact prescription longevity drugs. So again, front to back, we have diet and lifestyle, we have diagnostics and dentals, we got supplements, and we have prescription longevity drugs.
One step at a time. Let's go with diet, what you recommend. Obviously, I think most people know the kibble story. I mean, I know that the newer ones are better than the old sawdust stuff, but let's start with diet and lifestyle, and then we'll just go one step at a time and just kind of give people, probably a broader view than a real micro view, but whatever, this is your meal. You're the chef.
Well, and I'll keep it a little bit high level just because I don't want to bore your listeners to tears. But when we start thinking about diet, there are really 2 components to it. One is quality and the other is quantity. And so we've alluded to the quality part of things already. But basically, in general terms, to produce the average Purina kibble, Mark, what you do is you take your nutrients and you add filler and you add carbohydrates, because the carbohydrates are what really glom these little kibbles together. And then, number one, you have a high carbohydrate diet by definition when you're using a kibbled product. And then you run these high carb products through a 450 degree oven. And as a result, what happens is you get these nice brown little kibbles, but the reality is you also get what they call advanced glycation end products, or AGEs, which are known carcinogens for your pets. So the combination of the high carbs and the AGE presence in a lot of these kibble diets makes me want to run from them instead of run to them when it comes to the best nutrition for my pets. The other thing we have to understand is this. I mean, you look like you're in great shape, and I try to dance around the gym as often as I can. But the one mechanism that has been proven over and over again to increase lifespan in every species, whether we're talking about fish, whether we're talking about mice, whether we're talking about monkeys, or in fact humans or dogs or cats, is calorie restriction. And so in general terms, the thinner you are, the longer you will live. And that was proven in spades by a study put on by the Purina Dog Food Company about 12 years ago, where they divided litters of Labrador puppies in half, so that you had 20 litters of Labrador puppies. So let's give each of them 8 pups, just as a general, just for us girls to talk about. And so you had 160 dogs, and they divided that cohort in two. Half of those Labrador retrievers from one litter got all the food that they wanted to eat. All the food they wanted to eat. And if you've ever been around a Labrador retriever, that's substantial, and I have. And then the other half from the very same litter were given a ration containing about 75% of their calculated daily needs. So these dogs were kept very slim, and these dogs were followed through the course of their life. They received identical vaccines. They received identical food, just different amounts. They received, they were cared for by the same people in the same setting. And what they found, Mark, was that the thin dogs, the dogs fed less, lived 1.8 years longer on average than the dogs fed ad lib diets. And so that's kind of a classic quantity study that everybody refers to, because I don't think you can argue with the science. And so when I start thinking about diet, you and I, especially if this was part of one of my consults, you and I would sit down and look very specifically at the ingredients in your diet. But one of the hallmarks of longevity is also feeding less. Boom. So I'll take a break there, see if that resonates at all with you.
Well, it totally resonates with me, but let's talk about exercise now, because that comes along with it. When you talk about lifestyle, like I always try to explain to people, dogs get the same disease as a human. So if you can kind of put it in perspective that way, if I'm more active and eating healthier, I'm going to be healthier. So let's talk about what your recommended activity for animals are.
Absolutely. And so that's the reason I'd asked about your girl's weight. Because small dogs and cats are prone to one set of risks, and large breed dogs are prone to another. And in particular, the disease that many many large breed dogs run into, sometimes as often as young as age 4, is arthritis. And so everybody talks about how exercise is so important to our longevity and to that of our pets. But the reality is that there are good forms of exercise, Mark, and there are bad forms of exercise. And one of the questions that I pose to the patients or pet parents under my care is this: how many stairs do you have in your home? Because every time your dog goes up and down a set of stairs, there's incremental damage to their joints. When they're going down, it's the concussion rests in their elbows and their wrists. When they're going up, you see lower spinal problems, you see hip problems and knee problems. And so many times, one of the easiest things that you can do to extend your large dog's life is simply to buy a child's gate, a $50 child's gate at Walmart or whatever, and put it up. Not to eliminate the trips up and down the stairs for your dog, simply to minimize them. And another thing that you commonly see is, if you and I were building a house around your girl's needs, or more importantly, I have a golden retriever named Annabelle, who's sitting over here snoozing at this point in time. And she's going to be very prone to arthritis as she ages as well. And I have hardwood floors in my home. But the problem is that every time a dog, when you come home from work, Mark, your dog may come running around the kitchen island and hang a left into the hallway and then take another right to the door. And every time a dog changes directions on a tile or on a hardwood floor, there's a percentage of those dogs who skid out, who don't make that turn. And I'm going to tell you that every slip and fall is also cumulative injury to your dog's joints and your dog's spine. So if you and I were building a home together for the purpose of an older or a large breed dog, I would say it'd be a one-level home. It would be a home with full carpeting in it, as opposed to a tile or a hardwood floor, because these things will increase your dog's lifespan by reducing orthopedic pain. And so the other thing that I would call your attention to is just simply the form of exercise. Dogs on an evolutionary basis, Mark, they were walkers, they were trotters, they were runners. They were not jumpers. So when you and I throw a frisbee for a dog, or throw one of those the trapezoidal shaped kongs for a dog, so it's bouncing back and forth like this, it's horrible for their joints, the twisting play. And in many conversations, I use the analogy in human sports of a marathon runner who comes home as a 50 or 60-year-old and they still have a solid pair of knees, versus the basketball player that I once was in my life, or the football player with a lot of lateral motion and a lot of jumping. And many times you're forced out of the game by knee injuries at 24 or 25. So the moral to the story is that in a perfect world, at least according to Dr. Kevin, we would spend a lot more time in linear exercise for our dogs rather than making them jump up and down or twist sideways. Because here's the honest truth. Over my career, I'll bet I have seen 20 different dogs that walked into a park, frisbee in their mouth, on all four limbs, and came to me an hour later for ruptured ACL, ruptured cruciate ligament in their knee that was caused by the twisting and an awkward fall. So that's what I would say about lifestyle.
So basically, you're saying I should have a one-story house that's a loft. It has no turns in it, and it's all carpeted.
But here's the deal. I mean, one of the things, it's very easy for me to get on this high horse and, say this is what you need or this is what you don't need. But the reality is that some of these changes are incremental, Mark.
Sure.
If you and I just thought about feeding our pets a little bit less and feeding them a little bit better, and buying a child's gate to make those 20 trips up and down a set of stairs into 2 or 3 on a daily basis. And if you have an old yoga mat laying around, and put it on the floor in the one corner, the one hallway that your dog always slips and falls, to give them more traction. I mean, these are simple things. And listen, it's not a night and day thing, but the percentages add up, Mark. That would be my statement. If I told you that I think science supports a 25, maybe 28% increase in a dog's lifespan if they play by the rules, I mean, a percentage point here on the basis of diet, a percentage point there on the basis of stairs, a percentage point there on increased traction. The reality is those things add up longer term.
Oh, just for you and me too. Same idea.
Yeah, absolutely. I mean, it's a lot. And I still play the occasional pickup basketball. And I was pretty serious about that at one point in my life. But, the slips and falls and the recovery period, man, it takes a lot longer for me at 66 than it did for me at age 22.
It's amazing to me if I play basketball now, how sore my knees are. My lower back is always sore because you're just not used to it.
Yeah.
So phase 1 was this. What was the second one? I forgot. You had 4 things.
Dentals and diagnostics.
Yeah.
This is where your local veterinarian comes into play, because, the other reason, I talked about your girl being in kind of the sweet spot there at 45 pounds. But if you have a dog under 25 pounds, Mark, or if you have a cat, I would tell you that the single most common cause of inflammation for them is dental disease. And this is pretty strictly a small dog issue, a cat issue. But there's a human study that shows that for human patients with severe periodontal disease, they lived an average of 15% shorter lifespan than did people with a more normal dental health. And I think the same thing applies to our pets. And here's the hard part. The honest truth is this, and I'm out of the game, guys, so I have no horse in this race. But the honest truth is your small dog or your cat needs general anesthesia once a year for the purpose of dental care. The non-anesthetic dentals do nothing but scare the shit out of your dog and, out of your cat. They hurt, they're stressful, and I've seen bad things happen with just simply because of the stress. The reason that your veterinarian may suggest anesthesia as part of a dental cleaning is this. You and I can lean back with an x-ray plate in our mouth, and we can be told, stay still and don't move until the x-ray is taken. Our pets, no clue. And without those dental x-rays, a dental procedure is worthless, because almost 80% of dental disease lives underneath the gum. And listen, you can be the world's best veterinarian. You can look at a pet's teeth and say, oh man, they are perfect. But if you're not taking dental x-rays so that you can look underneath that pet's gums, you are missing significant dental disease, which would cause daily pain. I mean, who wants a toothache for Pete's sake? But you are also shortening your pet's life because of the infection and inflammation. So if you have that proverbial 25-pound and under dog or a kitty, please, again, this is number 2 on the list of things I'm going to ask you to remember. Please take them to your veterinarian. Take them to a good vet. And if your veterinarian cannot take dental x-rays, that's Latin for malpractice. I mean, in California anyway, if you can't take dental x-rays, you're not allowed to advertise dentals. And so take your pet to a veterinarian who can take x-rays under anesthesia. Let's solve all the inflammation. Let's solve all the infection in your pet's mouth on an annual basis, and your pet will live longer.
Well, what's funny is it's not fun. First of all, a dog or cat can say, hey, I got a toothache. They can't tell you, one. Two is that, I spend a lot of time at vet clinics. If most people that listen, if you haven't heard before, I have a company that has stem cell therapy for animals. So I'm in vet clinics. As of yesterday, I was in a couple. But what really surprised me years ago when I started spending a lot of time in the vet clinic is how many people are. I think now vets are more dentists than they are anything else. I mean, almost anybody now, it's very rare if I'm back in the back and they've got several different dentists on staff, there's always somebody doing some kind of dental work almost every time now. And it's important. It's a big germ. It's a big germ factory.
It really is. It really is. And the 3 different things that periodontal disease cause, Mark, one, I mean, again, nobody wants a toothache. Geez. I mean, think back to when you're a kid. But secondly, the bacteria that circulate through your blood as a result of periodontal disease settle out in 2 different organs. Number 1, your heart. They very specifically like the mitral valve, and they can cause heart failure. The other thing that the oral bacteria do is they circulate around the blood and into your kidneys, and that's a leading cause of kidney disease in both dogs and cats. So listen, I mean, there's just all these different tentacles, and the unifying thread between them is a clean mouth for your pet.
Well, it's funny. Like I said, I was in clinics yesterday, and one of the clinics was doing stem cells, and one of the things they're treating, which I'm finding, when we in the stem cells, for the majority, generally it's orthopedic issues, but I'm finding more and more, and a growing thing is kidney disease. That's a CKD, chronic kidney disease, is a big issue. It's funny, just randomly, I was going to do a study at Davis with the gal that runs regenerative medicine there, Dori Borzingen, is in Davis, where you went to school. And prior to COVID, we were going to do a kidney study, and then, of course, everything changed. Everything's changed now since then. But that's a big growing area, and I wonder if it's related to what you're talking about.
Yeah, cats are poster children for kidney disease, right. Chronic kidney disease. In fact, when I passed through Davis back in the day, there was an internal medicine professor who said, "Listen, if nothing else kills your cat, kidney disease will." I mean, it's almost an inevitability. But we know now that the 3 big contributors to chronic kidney disease in cats are a dirty mouth, as we've just been speaking about, heart disease, and high blood pressure. And point number 3 I'd make to your cat parents in the listening audience here would be, hey, when your cat goes in for an annual examination, make sure that your veterinarian checks their blood pressure. And it's a pain in the ass. And here's why. Because, our equipment is not always good enough to check a cat's check a cat's blood pressure. And inevitably, that cat is stressed. And so, you have a little bit of that white coat syndrome. But I would tell you that because of its relationship to retinal disease, because of its relationship to heart disease, and because of its relationship to chronic kidney disease, your cat's blood pressure should be checked on an annual basis.
Wow, that's crazy.
For real, for real, for real, for real, for real, for real, for real.
And we'll be right back.
As a pet lover, did you know your pet can benefit from the incredible healing power of stem cell therapy? Prep Therapy offers a groundbreaking solution taken right from your pet's own blood. Say goodbye to joint pain, arthritis, kidney and liver conditions, and more. They'll experience faster recovery, increased vitality, and extended quality of life without the need for surgery or harmful drugs. Put the wag back in their tail and discover Prep Therapy today at prepvet.com. Save 10% with promo code FurRealPodcast, covered by most pet insurance.
I want to talk about what you're doing so people understand, why you're the longevity vet, what you're doing, how you're doing that. So if anybody that's listening has some questions and can do that, let's talk about what you're doing now.
Okay. And so I listened to that. I'm going to give you just a 30-second monologue on the supplements and the prescription longevity drugs. And that is that, listen, guys, the supplement market is the wild, wild west. And there are a number of supplements that I used for years in my veterinary clinic that have been disproven. Amongst them are glucosamine and chondroitin glucosamine and chondroitin for your pet's joints. Simply doesn't work. Been proven in both humans and in pets. So there are different supplements that are proven to work. And you and I can talk in more length about that.
Because I've had 8 knee surgeries because sports.
Uh-huh.
So glucosamine and chondroitin are disproved now? I didn't know that.
Yeah. They just have been proven in study after study to be no better than placebo.
Oh, wow.
And so there are things that are proven. The soup du jour right now is undenatured type 2 collagen, or UC2. It's been proven to be as effective as nonsteroidal medications, nonsteroidal pain relievers in the treatment of human knee problems. And it's the baseline, for instance, of our orthopedic treatments. But the other things, Mark, so glucosamine, chondroitin, and resveratrol are 3 things that I would point to as being disproven. There are supplements that you and I can use, speaking very directly to your orthopedic issues, such as the UC2 that I mentioned, green lip mussel, fish oil, just old-fashioned fish oil, man, still works like hell in orthopedic disease, and CBD. CBD has been proven to help painful joints as well. And then moving on to prescription longevity drugs, the only thing I'm going to tell you, and I know you guys have been down the rapamycin rabbit hole, is this. Rapamycin, which is probably the single most studied longevity molecule in the world, has been proven to extend lifespan by up to 14% in every mammal species studied to date. And it does this by reducing cancer incidence. It does this by reducing arthritic and other sources of inflammation. So if you're a believer in reducing cancer, you're a believer in reducing inflammation, listen, let's talk about rapamycin in a different forum.
We didn't go that in depth on there. So for people that are listening, if you didn't hear the episode, let's talk a little bit more about that, because I'm really fascinated by this. One is from Easter Island and blah, blah, blah. But let's talk about it. Is it injectable or is it oral, and why? Let's talk a little bit about longevity with that, because I think it's an important thing to talk about.
Absolutely. I'm trying to stay on your timeline as best I can, but as you found out already,
there's no timeline on my end. I want to cover you.
You get me up on a soapbox, and man, it's all you can do to shut me up. So when I think about prescription longevity drugs for the average dog, I would be thinking about rapamycin. I would be thinking about acarbose. There are 2 different products that act in different ways. But speaking directly to rapamycin, this is an oral tablet that is given between 1 and 3 times a week. It depends on, there are a couple different protocols that exist right now. And, we typically recommend it just be given with food, but it's very, very safe. It started as an immune suppressive drug. So that if I gave you my kidney, Mark, at one point in human medicine, you would have been taking very high levels of rapamycin to suppress your immune system so that you didn't reject my kidney. And at those high-level therapies, we did see side effects from rapamycin. We saw blood work changes. We saw liver hepatitis cases. And so people come into this with a preconceived notion that rapamycin has all these negatives. But the honest truth is this. And this is borne out by the Dog Aging Project, as an aside, who's about 4 years into a 10-year study on the benefits of rapamycin across breeds of dogs. What we found is that at the low doses you and I use for longevity, rapamycin is one of the safest drugs that's out there. I mean, in my hands, I probably have 400 or 500 dogs under therapy at this point in time, and we see about 3% that have GI upset. That typically is just loose poop that it takes care of itself after 2 or 3 pills. But it is something that we should be aware of. We should also acknowledge the fact that if your pet is diabetic, we'd want to check on that, on your pet's blood pretty regularly as part of rapamycin therapy. But setting those things aside, as I mentioned, The longevity benefits appear to be really clear at this point in time. And perhaps 5 or 10 years down the road, you and I will know better. But right now, I'm going to tell you that rapamycin extends your pet's lifespan by up to 14%. It does this by having broad anti-cancer properties. And I can speak very directly in my personal experience to specific types of cancer that it seems to have shown significant benefit in. Changing a pet's prognosis. An oncologist gave one dog with an oral melanoma 4 months to live. We got 4.5 years out of that dog on rapamycin. And this dog lived an absolutely quality life during that time. So in addition to anti-cancer properties, it's also been proven to reduce arthritic inflammation. And so that's another point in its favor from a perspective of large breed dogs. It's also been proven in humans to reduce periodontal disease. It's been proven to reduce old age hearing loss. Old fart like me, that counts. And so there are a number of different age-related benefits to considering rapamycin therapy for your pet. And I don't want to belabor the point, but the other thing that's interesting is that there's this secondary drug called acarbose, and in the ITP studies that were put on by the National Institute of Aging, what they found is that acarbose is one of the 9 or 10 molecules that actually have been proven to extend life in mice, but just in male mice, Mark. And we think that if you use acarbose right alongside rapamycin, you can extend a male pet's life by an additional 5 to 7%. So pretty profound stuff. And, because now we're looking at close to 20% increase in lifespan if these dogs play by the same rules.
I'm not really informed on acarbose, so but let's go with that 20%. So if you've got a dog that's got a life expand, assuming it's going to live 12 years, you had 20%. That's 2.5 more years of life that they're going to have, and quality life too, by the way.
And the unfortunate example I would use when it comes to lifespan versus health span is that of my mother, who, bless her little heart, she was a smoker. And so she developed lung cancer, as many folks do. And she spent the last 1.5 years of her life in bed in mid-state Maine because her lung cancer had metastasized to her hip. And so she was bedridden for that last 1.5 years. And to me, I have plans B and C to ensure that does not happen to me. But there's a vast difference between extending a pet's life or extending a human's life and extending their health.
Right.
And so I'm about health span, Mark, not about lifespan. I will do everything I can to extend your pet's health span. And if we get a longer life out of them, so much the better. But we want to bend that curve. We want to make sure that they're as healthy as possible for as long as possible.
Okay, so we've talked about these two drugs, but I'm going to talk about you because you do everything over the internet. Let's talk about what you're doing and how, if I've got a dog that I'm listening to the show or find out about you through social media or whatever I find out about, and I'm thinking, well, I think Kevin's got some idea here that may be good for me. So how do they find you? And how does your process work? I mean, we're for you guys that are listening, we can see each other. We're on a video conference, kind of like Zoom, but which would be similar to what you're going to do if you're going to do telemedicine, basically. So let's talk about you. Let's talk about Longevity Vet, or helping pets live longer. HPLL. Pretty good for me to remember that.
Attaboy. Yeah, and so I've tried to take the 40 years of veterinary practice, all the mistakes and all the knowledge that I've gained, and combine that into kind of concierge practice centered around pet longevity. And the primary website that I use is www.helpingpetslivelonger.com, because that's exactly what my team and I do 7 days a week, is we do everything we can to help pets live their longest and best life, whether this is cats with heart disease or chronic kidney disease, whether these are dogs with heart problems or cancer problems or kidney problems. I mean, this is something I deal with on a daily basis. And so there are several different layers that we use. There's all kinds of free information, Mark. And if you were to hit our website, you'd find that we have functional health worksheets, designed to to cover every aspect of that heart disease, every aspect of kidney disease, every aspect of arthritis. You can download for absolutely free. But day in and day out, what I do most of are concierge consults, where you send me the last couple of years of your pet's veterinary records. I ask you to fill out a 4 or 5 page handout on exactly what their lifestyle is at home, how many stairs you have, what kind of tile do you have on your floors. And I use those data points to synthesize an assessment of where your pet is right now, but also to develop a plan for the next 2 years or 3 years or 5 years of your pet's life. Because here's the honest truth. Your veterinarian can't do that. Your veterinarian, with great respect, doesn't typically have the same amount of knowledge I have around longevity. And here's one thing that they absolutely don't have, and that is time.
Right.
If you, Mark, and I want to sit down and talk for the next 2 hours about your pet's healthcare, I can. But veterinarians these days are on a 15-minute clock or a 20-minute clock, and they may be hell on wheels when it comes to sewing up a laceration or lancing an abscess or giving your cat a vaccine. But the reality is that they don't have the time to sit and listen to you about your fears and your concerns about your pet's aging, and I do.
So the way I envision this, and tell me where I'm wrong, because I'm probably wrong, is that I'm in Texas, and I get online with you, and you and I are talking, but there are things you can't do in person. So you're in conjunction with me going to my normal vet. Is that kind of how it normally works, or how does that work?
Yeah, that's exactly the case. And then for people in California, I can prescribe these longevity drugs very directly. Most times in other states, I use a local provider as well. And so, but we can provide you with rapamycin and these prescription longevity drugs. But to be clear, this is not in as a substitute for your local veterinarian. This is designed to work right alongside your local veterinarian.
Right.
There are things that I cannot do that your local veterinarian can. And so in no way, shape, or form am I saying, this is come to Jesus, this is the new way in veterinary medicine. The reality is that my goal is to work alongside you as a pet parent and alongside your local veterinarian to maximize your pet's health span.
So you're the appetizer and the dessert, and they're the meal?
Well, yeah, I don't know. There are other metaphors in there that could probably be used, but the reality is, yeah.
Well, I'll just call you the dessert. How's that?
All right, there you go.
So if I'm talking to you and you say, okay, I think rapamycin would be really good for you, but it's an injectable, you can write the script. How does that work?
So it's an oral tablet.
Okay.
So rapamycin, these medications are all strictly oral. And I would tell you this.
Okay.
And you can edit this out if you choose, but
No.
there's tremendous interest right now, Mark, around the use of peptides in pets.
I want to ask you about that.
And well, it's going to be a short conversation with me. And here's why. I think there's a tremendous business opportunity there, because I think there's an awful lot of increasing science that tells us that a lot of the injectable peptides, like the GLP-1s, et cetera, that you and I would take for weight loss or whatever the case may be, have benefits that would extend to our pets. But I would tell you that in my little practice, I'm very cautious about that, because these have to be given as injections. The oral medications simply don't work. The oral peptides by definition, they're proteins that are torn apart by the stomach, by the acid in our stomachs.
Right.
So these have to be given as injections, and I just can't figure out a way to sell those ethically or safely to the patients in my care. So I'm steering clear of that for right now. But I think there is tremendous opportunity, and at some point, you might walk into my longevity practice. I think there is a great opportunity for longevity science to enter a brick and mortar veterinary clinic. And if that were the case, peptides would be a large part of what I would do.
Yeah, I'm kind of been doing a lot of research on it, and I had somebody on that's a big fan of peptides. Mm-hmm. What I'm hearing is positive, and I kind of want to try it because, like you, I am a gym rat too. But, it's funny, I have a coffee shop that I generally go to after I've been working out, and I've got a couple of people that I know that are 100%, 125% into peptides, but they're spending $800 a month per person on this, and I just don't see for me personally, the benefit for that. But, everything I've heard, if it's a quality product, and that's a big, big, important part of it.
Absolutely.
Is really positive, but it's early in the animal world in particular? I mean, and I think that's where you're probably hesitant on specifically, aside from injectables.
I don't know enough to be able to look you in the eye, Mark, as a pet parent and say, this is what your girl needs or this is what you have to watch out for. And I don't feel comfortable just sending you a syringe to be injected into your girl. It has to be kept cold because proteins are denatured by heat.
Right.
I mean, there's just about a bazillion variables that I cannot address, Mark. And so maybe at some point you and I will change the tune of our story. But at this point in time, I think peptide therapy for pets has tremendous opportunity. It's just not something that I'm not smart enough to fully answer that at this point.
Trust but verify.
There you go. Attaboy.
There you go.
Attaboy.
Okay, so what have we missing? Because I mean I know I don't want to keep you on forever. What have we not covered about what you do? And then I want to tell everybody how to find. I know you already said the website site, but I want to repeat that. I also want to talk about your social media. But what have we missed that we haven't covered? And I'm happy to talk for as long as you want to talk.
Realistically, I think we've given your listeners a great summary of longevity medicine for their pets and around the framework of 4 pillars that we've talked about, whether it be diet and lifestyle, whether it be dentals and diagnostics on the part of your veterinarian. And I guess that is something that I'll segue back to. There's increasing evidence of the values of kind of a functional health approach in human medicine, Mark. And by that, I mean, instead of waiting until you're sick or you're broken, maybe there are ways to use blood and urine tests to identify risks and try to avoid them, try to modify those risks longer term. And so one of the things that we're getting into in a larger way is the value of early detection blood tests, early detection urine tests for these pets at 4, 5, 6, 7 years of age in an effort to head off some of those kidney disease problems, head off some of those heart problems down the road. And in many ways, this mirrors the approach of function health on the human side. There's a big website around that. And our goal, one of the ways that you and I can work together to increase our pet's health span is to diagnose trends before it develops into an incurable disease. If you and I can head that sucker off at the pass, your pet will live longer as a result. And so that is one component of what I do.
One thing we talked on the supplements that you're against. Let's talk about if you were to have your animal on supplements now, what would be the main ones that you would tell people right now that would be beneficial? Are there some that you would say, get on now?
Yeah, there are 2 that I would recommend, and one we've alluded to already. I mean, so many large breed dogs are prone to orthopedic disease that the undenatured type 2 collagen, or UC2, would be a great baseline approach. In fact, I have this 18-month-old golden retriever, as I've mentioned. She's already on UC2 to help support her joints, and we're a long ways from developing problems, but my goal is to prevent that. The other product that I would recommend that anybody look at, Mark, and this may segue into a longer conversation again, is curcumin. And the backstory to this is that about 18 years or so ago, I was diagnosed with a fatal cancer and by a local GP down there in the southwestern Colorado area. And I self-referred to the Mayo Clinic after 2 months of stress. I mean, I thought I was bulletproof, and I found out that I was not, Mark. And found out that diagnosis was wrong, but that I did have a precursor to a type of cancer called myeloma. And so you would, and I did, look at all the different ways that you could try to prevent the transformation of this pre-malignant disease into myeloma. And I found not one pharmaceutical drug that worked, but there were several studies that showed very clearly that curcumin worked to minimize the chances of this progression from the pre-malignancy into myeloma. So on that day, baby, I became a curcumin kid. And so that really opened the door to me, for me, to integrative therapy or to herbal therapy. And so to this day, I use curcumin products as a mainstay of my longevity business because they've been proven to reduce cancer. They've been proven to reduce arthritic inflammation. They've been proven to reduce our Alzheimer's incidence in humans, but also chronic kidney disease and liver problems. And there are just a number of benefits that are proven in over 5,000 studies on PubMed. But here's the thing. Curcumin is not turmeric, and a lot of people use them synonymously. They use them as equal ingredients. And the unfortunate truth is this: if you are giving turmeric, if you're taking turmeric instead of curcumin, if you're giving turmeric instead of curcumin to your pet, you're likely receiving zero benefit, because the only active ingredient in turmeric is curcumin. It only comprises 3 to 4% by volume of that big turmeric plant, excuse me. And curcumin is not absorbed worth a shit. And so you have to use proprietary products that enable better absorption of curcumin to get any blood levels at all. So let me repeat that. Turmeric is not curcumin, kids. And if you are taking turmeric, listen, I'm going to give you a free resource here in a couple of minutes, and reach out to me. Let's talk about it, because there are ways to better improve your pet's health, or for that matter, better improve your health.
How do you spell curcumin?
Curcumin.
And what you said, if I heard you correctly, I'm not really good at listening, but if I heard you correctly, you really need to get somebody that's got a good product for it that's really working. So you have to go through you or somebody that's qualified to have the right product. Is that what you're saying?
3 or 4 products that are out there on the market that actually work, Mark. And I'm going to say this: ours is the best. Listen, I sell Undinature Type 2 collagen for your joints. I do. I sell it every day. You can find that a lot of different places, probably cheaper than I can sell it. But I would tell you that the curcumin product we carry is the best, for the very reason, I still take it on a daily basis. And the curcumin that we use is patented. It's been proven in studies to be 106 times more bioavailable than standard curcumin. And so you want to take 106 tablets of curcumin on a daily basis, you knock yourself out. Or you can take one of our capsules. And the same thing applies to your pets.
Yeah, I was going to say, the ones you have, is it the same thing that a human would take as well?
Absolutely. Yeah. Yeah. A lot of my pet parents, they start out giving it to their pets and they end up taking it themselves.
And it's just from a dosage standpoint, it's like 1 a day, kind of a thing like that. That's what it is.
Yeah. Yeah. You and I would take 2 a day as a rule. Now, in all candor, in all honesty, I'd take 6 or 7 a day because of the health history that I have.
Right.
But yeah, for the average adult human, it's just 2 a day.
Okay. What else have we missed? Anything? I'm 100.
I think by golly, I think we're going to wrap this up. We need to talk about bone fishing or fly fishing on the Gallatin River. Let's get back to some of the other important things in life.
Well, that's, by the way, that's lifestyle. That goes with that. 100%.
There you go. Attaboy.
But let's repeat your website, your social media, and that. And by the way, anybody that's listening, as I always say, this is all in the description. But go ahead and repeat it for people that aren't going to go to the description. So we have that.
All right. Well, listen, my day-to-day website, guys, is www.helpingpetslivelonger.com. But I mentioned a free resource a couple minutes ago, and that is that I have a secondary website called freevetcall.com. And this is specific for Mark's podcast listeners. And so if you're interested in learning more about me or curcumin or longevity science in general for your pets, how to help them live longer and healthier, please reach out to me. Go to www.freevetcall.com. And listen, this is just a one-page website that links you directly to my calendar so that you can schedule a free 10 or 15-minute consult around any component of your pet's health. I'm happy to chat with you. This is one of the ways that I feel like I'm trying to give back to the pet parents of the world. We are all in this together, and I will help you if I can.
That's great. And what's your social media so people can follow you on social media and all that kind of stuff?
At the Longevity Vet, baby. That's where I live. At the Longevity Vet.
The Longevity Vet. Are you on YouTube? I don't know if you are or you aren't.
Yeah. I have 60 or 70 videos up there, ranging, on all different topics, ranging from constipated cats to orthopedic dogs. And so, yeah, I'm not as good about posting over the last couple of months as I should be, but I'm going to get right back on there. So stay tuned. Stay tuned, my friend.
I'm a constipated cat with a lot of old dog arthritic problems. That's kind of me 100%. Okay, so we're at that point where the joke time comes, and it's not a very good one because I'm the one that's doing it again today. But as I always tell everybody, please, please, if you want to be on the show, you've got grandkids, you personally, your nieces, nephews, your kids, you want to be on the show, if you email me at mkyle@forrealpodcast.com, I promise you I will gladly, one, get back to you, but two is I will gladly have you on the show to tell the joke. So here's the joke for the day, and it's related to what we're talking about. So we're talking about my dog, Mabel. So Mabel really thinks that she's on a longevity diet. What do you think she thinks it is?
I'm going to remain mute on this stuff. So this joke is yours. So run with it, baby.
So I told her she's on longevity diet. She said, you mean, I think your longevity diet is that I'm always waiting for you to drop the food on the floor. That's her longevity diet. Bad, yeah. Real bad. That's a real bad one. Anyways, I forget about that. So first off, thanks so much for being on the show. I really, really appreciate it. I find it fascinating. I want to know more about Kuckuman myself now. I didn't know much about it. And I'm happy we get to meet each other, and I'm glad you're on the show. So thanks so much.
Thank you very much, Mark. And let me repeat what I said earlier. The reality is that most folks don't understand how much effort Mark puts into this on a weekly basis. And so my hat's off to you. You're doing a great job for pet parents, and I really appreciate all your work.
Well, thanks so much. And then for everybody else that's out there, as I always say, without you guys following, listening, passing the word on, I don't get good guests. I mean, I've grown because of the audience, and the audience is really the ones that have really made it happen. And because of that, I do get good guests. And lastly, also, I would recommend to anybody, if you got a good idea for the show, again, email me, and I promise you, I get back to everybody. But really, truly, for everybody that's out there listening and keeps helping us grow and help me get the great guest I am, thank you so much from the bottom of my heart. For real.
That concludes this episode of For Real with your host, Mark Kyle. For previous and future episodes of For Real, listen via all major podcast streaming sites.
At Arizona State University, we've made online education better, smarter, and more personalized so you can go further in your aspiring field.
I decided to pursue medicine once I realized that ASU did have the online program for biological sciences. You're still required to learn the same curriculum. You're still being tested on the same content that anyone would be tested on in person. The comprehensiveness of the program prepared me so well for medical school.
Explore over 350 plus programs at asuonline.asu.edu.